Thank you, Chairman Cox, and good afternoon. Our message today is very clear. It is to stay the course. As we have stated multiple times, and we will continue to reiterate, the day-to-day numbers and the day-to-day statistics that we share and the charts we share do not tell us a lot of meaningful data. We need to see significant trends over extended periods of time. There are fluctuations in day-to-day totals that really are beyond our control, but in the effort to be transparent, we are continuing to share everything possible. Not only testing, positives, ICUs, hospitalizations, the unfortunate loss of life. We're continuing to share this information by jurisdiction, by zip code, by race, when possible, gender, age, when possible, and in every way to ensure that we are providing you all of the information that we have. But I want to reiterate that the day-to-day totals are not particularly meaningful in predicting what the future may hold. It is going to take a sustained amount of time, and so what we are asking the public to do is continue to stay the course, continue to adhere to all of the advice and the guidance we've given, and continue to focus on the things that we know. Physical distancing, staying at home, covering your face, hygiene, along with the things that we know in terms of raising the bar in our health system capacity. Yesterday, we reported only 50 new positive cases, and today we are reporting an increase of 76 for a total of 1,530. And I know that in the need for instant analysis and instant information, it can be very difficult to accept some realities of the situation we face. But I want to reiterate a couple key points in response to a number of questions that have popped up. First, the geographical breakdown of positive cases do not tell you anything meaningful at all, other than the individuals who happen to have gotten tested, listed an address that is their home. It does not mean that that is where they contracted coronavirus. It does not even mean that that is where they physically are now in a state of recovery. It simply means that an individual who had access to a test, that test reported positive, listed that as their home address. With the limitations on testing, it is fair and safe to assume that every single zip code in San Diego County has positive cases. And we continue to encourage the public to assume, one, that you are positive, and two, to assume that those around you are. Those are the safest way that you can approach this in terms of staying at home, covering your face, ensuring physical distancing. Number two, the day-to-day totals really don't tell us a lot. We would need to see at a minimum a week, but more likely considerably longer than that, to have it have any reliable predictability about the trends or the directions on where we're going. While there are some encouraging signs of how California is doing as a whole, and there are some encouraging signs of how San Diego is doing compared to other urban areas of the state of California, the reality is we have to stay the course. The progress that we are seeing in San Diego and the progress that we are seeing in California is a result of the early actions that we took, but more importantly, a result of the widespread adoption that we have seen from each and every one of you out there. And we need you to continue to do that. Because if we misinterpret any evidence or data to suggest that the progress we were seeing in any way can allow us to lessen the commitment that we have, then all of the meaningful progress that we've taken to date will be undone. So again, any progress that you see or stories you see out there is a cause to celebrate the early actions in San Diego County and the state of California, to celebrate the early actions we have taken, but in no way can those be used as an excuse or a rationale or a thought process to any way deviate from the current guidance, or else everything can be undone in an instance. We know for a fact that our current restrictions and guidance will remain in place for at least the entirety of April. We have stated time and again the vital importance that the month of April presents to us, and we need to continue our full-scale commitment to the month of April. We also know that our early actions help buy us time. It bought us time to increase our health system capacity, both increasing in structure, increasing in staffing, increasing in stuff. We also knew that it gave us time to acquire personal protective equipment. It gave us time to get an increase in testing, and those are all things that not only help us navigate through the current situation, but prepare us for a day in the future when we begin to ease out of the situation we're in. At some point, that we do not know when that will be at the present, we will start to come out of the current environment. But it is really important, vitally important for the public to understand that we do not yet have a clear sense of when that will be. But when it happens, we will be very gradually coming out of the current posture that we have. And we need to prepare ourselves for that as well. In order to arrive at that date, we will also need the readily accessible rapid testing, tracking, tracing, and the appropriate way to put individuals who are positive in isolation to make sure that we don't prevent additional outbreaks. As we have examined a wealth of data, we spent a lot of time looking at the 1918 flu. And what you see in response to that pandemic was a number of jurisdictions that did not move fast enough to put in place restrictions early, and they paid a tremendous upfront cost. But what you will also see in response to that was a number of jurisdictions that came out of their restrictions too soon. And they had a second wave that in some ways was much greater than the first wave. Here in San Diego County, we did not make the first mistake. We did not wait to move too soon. We moved early, we moved swiftly, and our region is benefiting from that. And here in San Diego County, we will not make the second mistake either of coming out of that posture and scenario before it is appropriate and before it is being done in a thoughtful way based on data. So we again encourage you to adhere to the guidance, to commit to the guidance. The reason that we are in a better position in our state and our region is because of those actions, but we have to continue with them with all of our force and all of our commitment, at least through the entirety of April. Two other quick points before we get to our charts. On Friday, we will start sharing a few metrics that measure our county-wise adherence to the measurements put in place. This is some mobility data, some traffic data, some other data. We think it'll be a good way for us weekly to check in on our regional progress and get a snapshot of information. Some of that we shared yesterday and at our board meeting, but we plan to share that this Friday and every Friday moving forward. I also want to share with you that we made a small amendment to our public health order to bring it consistent with all of the guidance we've given. The old order had a mass gathering limitation of 10, but as we all know, there are no mass gatherings at all because the order is to stay at home unless you have to leave for an essential job or an essential service, and so that public health modification will go into effect now. Before I get to our charts, I want to give a special shout out to all of the San Diegans who heeded our call. We put out a call for individuals to sign up for our Reserve Medical Corps, and that call has been answered. To date, more than 550 clinical persons, doctors, nurses, EMTs have signed up to be a part of our Reserve Medical Corps. 200 additional non-clinical individuals, these are folks with healthcare experience and logistics and administration, have signed up. We have 150 additional physicians that have been made available by the San Diego County Medical Society, and we have 574 persons who have signed up for the Reserve Medical Corps to join but have not yet been assessed. To these folks, we thank you. We appreciate you. We value you. We also ask you to hold fast where you are. You are in ready reserve in the event that we encounter a situation where we need you. And so you may not be contacted immediately, but know that we are tracking you, and we do appreciate you, and we will continue to assess the need on a regular and daily basis. Let's jump into our charts real quick. I mentioned today we have 76 new positive cases for a total of 1,530. On testing, we have our testing chart back. You can see an increase, both we are now well over 20,000. We are at 21,718 total tests. Again, the day-to-day numbers mean very less. It just is the continued trajectory and continued increase. Here you can see our total testing at over 21,000 relative to our positives at just over 1,500. Again, we continue to have about 93% of the tests come back negative. That number has held steady for a little bit. Our chart that compares our positives to our hospitalizations, the newly added estimated recovery period. Just to reinforce, we are following what is accepted to be best guidance on the estimation of recoveries, which is 14 days after a positive test, minus any loss of life. This is pretty standard, but this is an estimate that you see. Again, you can see our hospitalization number at 316, ICU at 122, and deaths at 36. Our rate of doubling for hospitals is 7 days. Our rate of doubling for ICUs is just a little bit over 7 days, which are numbers that we continue to track, but are important indicators of our progress as a region. Motel rooms, we saw a pretty significant jump. increase in our public health rooms and occupied, increase in guests, pretty significant jump in the Regional Task Force on Homeless, occupied, and guest totals as they continue to advance with their mission of tackling the regional issues surrounding homelessness. Outreach efforts, 211 calls up, nursing calls up, epi calls up, hygiene calls up, hand washing stations and toilet distributed or static pending any additional requests for those. On personal protective equipment, an increase in every category. More than 50,000 individual items of personal protective equipment have been distributed since we spoke to you yesterday, bringing us to almost 1.9 million individual items of personal protective equipment that have been distributed. Ventilators, all 23 of 23 hospitals are reporting 533 available. That is not the total number in San Diego County, that is the total number that are available, along with our almost 100 ready to deploy, our 53 being serviced, along with the requests we have from the state of California and those that we have ordered. The final thing is an update, a quick update on the pledge that we put out. A number of jurisdictions have been doing these to great success as a way for us to continue to reinforce what we're doing. Over 11,000 San Diegans have pledged to stay home and save lives. These individuals are making a commitment not only to themselves but to one another. Today we are adding and encouraging folks to download. We have some wonderful signs that you can post in your window. There are a variety of options that you can print off from the website and either write in your own message of who you're staying home for or download an accessible one. If you do one of these, feel free to post it online and tag us with Stay Home SD on social media posts as folks post these in their windows, again, as an outward sign of community solidarity and community action to try and tackle the challenges we face.